Hi everybody, thank you so much for coming and welcome to this next EMCC Global GPS Dialogue. So pleased to have Andrew Parsons with us here today. Andrew's going to be talking with us about coaching and mentoring in integrative oncology. And we were just speaking before we started this session about the similarities that there are in the work that Andrew's doing with oncology patients and the work that coaches and mentors do with the people that they coach. I won't say too much about that, but I'm going to pass you straight over to Andrew.
Thank you so much, Nicola. It's a real pleasure to be here today and sharing some of my experience of working with those individuals and family members who are impacted by cancer. And just to sort of build on that point, coaching and mentoring is just it's one of those things that just creates that space for people to think and often sort of align on goals or develop intentions that's going to be so useful. And I'd just like to give you some background to how I ended up here today talking about this potential for coaching and mentoring in integrative oncology. And I would like to provide a huge shout out and thank you to all the staff at the Fountain Centre and the Royal Surrey NH Foundation Trust who 2014 started developing a coaching service, which I was very lucky to be involved with creating. And so I'm, just to say I'm presenting myself here as an independent. I'm not talking for the Fountain Centre, but there are a bunch of wonderful individuals without whom we would not be able to share our experience. Just to recognise the current members of the coaching team who are outlined below on the slide here. And one of the most interesting things when we started this was really thinking about, well, where would coaching, mentoring fit? And these are some of the health needs assessments that have been developed and I think are categorized on a regular basis. And this is just one that was shown to us from Anne at the centre. And we just think, well, maybe something to think about in terms of an integrative oncology perspective. Working, coaching, mentoring fits in supporting people find the ways of living with some of these concerns and issues that they're faced post-cancer. As I said, we have a very active group of about 8 or 9 professional coaches, and the model that is developed really successfully within the Fountain Centre, because I think they've been operating now for over 21 years, is that as professionals, we donate time to the charity. So, for example, when I started, I'd be there one afternoon a week, providing coaching, mentoring support to patients and family members. And this model, it operates through all the complementary therapies. So wonderful experienced practitioners donate their professional time. The clients donate what they can to the charity, and the charity is really heavily embedded into the Royal Surrey NHS Foundation Trust. In terms of us supporting ourselves as coaches, we really recognise, and I'll come on to this a little bit more later on in the discussion, the absolute importance of supervision for ourselves as a co-learning environment. But also one in which we can sort of not only develop ourselves and our practice, but provide support to other members of the group and provide an opportunity to develop our own self-care. We got together through our practice-based learning discussions and created this book that was published on the 4th of February this year on World Cancer Day, just to outline an important framework that we thought was really important for building a sense of empowerment. And we use the term empowerment very specifically here because often we, as coaches and mentors, we talk about supporting our clients to thrive or flourish. But we felt from working with our client base here that actually that didn't really land very well with us. But having that ability to be empowered and create that active participation was really the work we were doing. And the 3 pillars are awareness, information, and learning. So these are our topics for today. Raising awareness of integrative approaches in cancer care. And from that, just exploring how coaching and mentoring may fit into an integrative oncology as a whole. Share a process that we've outlined in the book for patient empowerment, and outline a synthesis of evidence-based approaches to enable personal leadership within our clients. I found this definition of integrative oncology really powerful and really useful. And it also sounds like coaching to me. It's patient-centered, evidence-informed, that utilizes mind-body practices, perhaps natural products and or lifestyle modifications from different traditions alongside traditional cancer treatments. So this is how this goes on in the world. This is how people live their lives. It aims to optimize health, improve quality of life and clinical outcome across the cancer care continuum. And these are my italics, but this really sort of comes to me about that place about empowerment and thriving, to empower people to prevent cancer and become active participants before, during and beyond cancer treatment. This is taken from the Society of Integrative Oncology, and I think this was based from a work where they surveyed everybody, well, not everybody, but a whole range of individuals who are active practitioners, and this is the consensus statement that came towards. What comes up for you when you read this?
I think for me, it sounds very much, a definition here of integrative oncology sounds very much along the lines and the aims and the objectives for coaching and mentoring. If we for the moment put to side that we're talking about patients, we could easily be talking about business leaders, or we could be talking about people who are needing some help in their personal lives. So for me, it seems like it's a great analogy for each other.
Thanks, Nicola. That really resonates with me, because one of the early conversations we had with people in the centre was, as executive coaches, what we often do is work people take on new roles and develop new identities and manage different aspects of their lives in situations that they may not have been prepared for. And we thought there was an interesting parallel around how we support people enter new roles in business or life, and how to support people adapt and thrive, or become empowered and active participants in what's going around them.
Andrew, if I may, this is Mirala. I'm just trying to understand, this is a program that you initiate long-term, because, for example, in the work that I do with cancer patients, I volunteer work, and as a coach, I'm trying, to put a little bit bits and pieces from the coaching practice, but I don't see them after that. We actually have only a limited time with them, and then we can come back, the next week or 2 weeks after, maybe they're gone. From the world. And this program, it looks like it's a long-term work with patients, with specific patients. Is that so? Do I understand it correctly, or
thanks for
can I apply it also short term? There are some techniques that I can learn and apply them just in those hours that I spend with them?
Great questions. Absolutely. I think we can maybe touch on some of those today. I think that the service is really interesting, because up until COVID, I spent half a day in the centre every week, and I was never quite sure who was going to be my client when I got there, unless they were pre-booked in. And we'd set up coaching discussions with people, where we'd probably aim for around about 6 sessions over however long they thought it would be useful for them, usually a couple of months, but we'd always review after 3. So we'd have a rolling, let's use 3 sessions and see what, whether we're going to get you, to where you want to be. What we also found was people were using the service and may just have a single conversation and say, thank you very much, that was really useful, that's all I needed. Or it may not have been for them, and we don't know. But my experience is, sometimes when you're even in a business sense, a single conversation creates an insight or a learning, or just that thought process to get clarity, which is enough for people to then become more empowered and be able to move on. So I think it's always good to consider a longer term program, because it just creates a alignment and an opportunity to view any emergent goals or any specific goals that may be there. And I'll come on to that in a minute or two. Prevention, protection, health promotion are all really important elements of this integrative oncology, isn't it? It's about how to optimize my lifestyle, you know, to manage my situation and my health.
Michelle makes a really good point, actually. It strikes her that the empowered approach balances that feeling of being out of control when a cancer diagnosis is given. So in a time when you're freewheeling and quite feeling vulnerable, it provides some structure.
Absolutely. And I think even just some simple things, you know, in your first session around providing that opportunity for people to become more grounded. So like breath work, or mindfulness-based approaches, or you know, just that ability to be alongside somebody and witness what's happened to them, so that they feel that they can be heard, can be incredibly powerful. You know, and the start of that place of empowerment. So I thought these statements from Dr. Nina Fuller-Chevelle was really interesting for me, actually. So Nina's the coach of the British Society of Integrative Oncology. And what it should be is a rational integration of the best in conventional lifestyle and complementary medicines. Whole person orientated, that addresses physical, emotional, mental and spiritual needs. I'd probably add occupational and social there as well, particularly when you're living with and beyond cancer. Your relationships, you know, in and out of work are really important, and that actually features as quite a large part of the conversations we have there as coaches. It should be, you know, supportive with targeted, personalized medication when necessary, without over medicalizing. It's about caring for people, not you know, running them through protocols. It's really providing that person-centeredness, and really using the best evidence base that we have. You know, what it isn't, I think it's always good to know what things aren't, and you know, this is also very important in coaching. It's, you know, disregarding the science. It's not about supplements. It's actually integrating, you know, lifestyle with the appropriate medications. It's got to be safe. It's not about applying the same things to everybody without providing some personalization, or doing random things on the off chance that they may help. So it's about, you know, using science to enable us to provide the best support. Now, for me, my background is in sciences. It's really important that we harness evidence-based practice wherever we can, but also as an innovation scientist, to actually sort of use scientific principles to create new practice as well. Just to pause there, any questions, any thoughts?
And Andrew, this is Nagesh. I really appreciate this distinction, because a couple of thoughts come to mind. One, the extension of this integration in the COVID context, in terms of, you know, people going through either primary or secondary trauma, could be related to, you know, cancer patients. But the other piece that I see a lot is, you know, the notion that really when you have cancer, and if it's, you know, late stages, is the fact that it's the family as patient rather than just the patient themselves. And so, and maybe you're going to touch on it, but I'm curious to hear more about how that comes into play of the collective in the integration piece.
Thanks, Nagesh. And just to say now, while it's in my mind, the charity, the Fountain Centre, offers a children's and family service. So it supports children of families impacted by cancer. And they're very, very interested in bringing coaching into that approach, you know, as the service expands and develops even further. And it's quite amazing, because one of the facts that Anne and Danny, who's the psychological lead, they showed me very recently, was, I think in 24% of all new cancer diagnoses, for that person who was diagnosed, they have a child of school age. So, you know, this, you know, impacts us all. And if we're thinking about, you know, diagnosis rates going forward, then I think it's something like 1 in 2 of us are going to expect a cancer diagnosis in our lifetime, in the very near future. So this is just in society, it's in work, it's in our families, it's in our networks. And how to support people live well in all that system is a really wonderful place for coaching and mentoring to sort of support. Brilliant, thank you. I'll just sort of push on. So last weekend was the British Society of Integrative Oncology's inaugural meeting, very wonderful meeting just to hear what best practice that was going on. And what I took away from that was as a coach is the kind of really sort of 4 key themes of practice. One was around physical activity, the other was about nutrition and diet and all the advances that are being made at the moment, particularly in terms of the microbiome and how our choices over food can affect our physiology and even clinical outcomes, sleep and other psycho-emotional needs. You know, anxiety, fears, these were featured very highly in the electronic health needs assessment, you know, from Macmillan. And there's a lot of support for, you know, that we can give for people in that area. Just to touch on health and wellness coaching in the US, because I think there has been absolutely some wonderful and fantastic work done in the US in terms of providing health and wellness coaching support, which is now board certified and I think is able to be reimbursed. I'm not quite sure of all the details on this, but there's a wonderful training that people go through to be able to operate as a health and wellness coach. There are some great resources out there with evidence-based assessment of the value of health and wellness coaching that I run. I think it's, if you contact me, I can send a link to you. I can't quite remember, but I think it's the Journal of Lifestyle Medicine. And there's a compendium that's been brought up with evidence-based trial data from the impact of health and wellness coaching. What I noticed as a coach in this, particularly with somebody who was interested in working in the oncology area, there was perhaps a few less studies happening in cancer than there were in many of the others, particularly in diabetes and I think in rheumatology were the ones that stand out for me at the moment. And the ones that were in cancer were all about quality of life. And that really resonated with me and the practice that we have in the Fountain Centre. Chiefly because you know, the coaching topics that people are often bringing are not about cancer. They're not about treatment. It's about themselves and how they be themselves in this space of the, you know, the impact of this diagnosis and treatment that has changed their lives. And there is actually some, you know, some real interesting data out there actually about the impact of chronic illness. So as long ago, what's that, 40 years ago now, nearly, in the 1980s, first described in rheumatology as, you know, this altered biography that we have, you know, when we experience chronic illness. And this can really impact the availability of resources that we have, that we can access, our social connections. People see us differently. Very, very true with cancer. And when I did my master's study, some things really sort of came home to me in this. If you know, if you talk to people's experience of going back to work, often they're physically different. They may have different coloured hair following chemotherapy and radiotherapy. And one person said to me, they went back into the office where they'd worked for 30 years and nobody recognised them. You know, so that feeling of isolation as you go back into something where you're trying to get back into a normal life, how to support people in the best possible way there, and of course uncertainty. And you know, that really is, you know, this sort of Damocles that hangs over us, you know, and how can we enjoy ourselves with this level of uncertainty? How can we thrive or become empowered and have that active participation? And of course, you know, there's a lot of things that happen to individuals, to ourselves, when we experience chronic illness. You know, we may have changes in mobility, changes in mood and attitudes, you know, particularly to work and lifestyle, and we might need to develop a whole range of different support mechanisms. This to me, I think, is the essence of a lot of the practice that we do in coaching in the centre. And you know, this is a common theme that comes around for us all, though, which comes out very strongly in supervision. It's how do we support and empower or support people to become empowered, because we can't empower them. How do we create the environment for them to find that themselves?
Andrew, there's an interesting point in the chat. So about, and that, I think that segues nicely into that point you just made, actually, is how do you make sure that you don't cross over into the counselling space?
Oh, great question. So in the service, the way we do this is that we have a registered healthcare professional who is the if I could use the word triage, it sounds a bit clinical, but actually there's a discussion that happens with a healthcare professional where the opportunities for support are discussed, and the client then can have a choice around which pathway they may go down. And the centre offers counselling, coaching and listening services, and also a whole range of complementary support as well. So there's an active discussion in selecting the path where the client wants to go. And I'll come on at the end around perhaps some areas in terms of thinking about where are people in the moment, and what support might be best for them. Essentially, if people are really struggling and in the space of loss, coaching isn't really the best support for them, I would argue, because their ability in that place at that moment in time to learn and develop is probably not as strong as it could be. What we sometimes find is people go through counselling, which is really powerful, really what they need, but then struggle to move on to that next step about becoming really proactive and active in their life. It's really about thinking about, how do I build skills in my life to adapt to the situation where I am now? So there's very much a multi-modal, if that's the right phrase, or a multi-service approach that we bring in. But I'll come on to that a little bit more in a while. Thank you, great question. Maybe this is a good point just to build on in that segue. First breakout session, 15 minutes, we saying, Nicola? That should give us plenty of time, I think, shouldn't it?
Yeah, that's actually fine. I'll break that for 15 minutes.
Part of the conversation we had in our room was around the ability of the coach to create that safe space. and there's something about being able to listen to people and be alongside them and witness their experience, which for me, I think I'd call it probably more therapeutic than therapy. But having that psychological safety to explore what's going on for me right now, it can be really, really powerful. And just think about, well, what might be useful? What would be useful for me right now? Is a really wonderful question. What would help now? Yeah, thank you, Roz. So it's really interesting, isn't it? Because sometimes when we're working with clients in this area, they don't quite know what the solution will be. If you're having, if you've just finished treatment, then there's going to be a period of readjustment and rehabilitation, and you might not quite know how I'm going to be able to spend my energy. What am I going to be able to do? What's my physical energy going to be like? And we were talking about the difference between a goal and an intention. So, an intention maybe is something we move towards and explore as it emerges, and retune and redial to hold an intention rather than finding solutions. Really, really powerful.
Alina says you have 2 sets of patients. Alina, I wonder if you could.
Yes. I think that we have to break. I'm a marketing person, so that's why I'm thinking about dividing cancer patient into sets. The patients that will survive. So this is the first set of patients that should be approached in one way, and the patients that are in the metastatic stage, and we are not really talking about palliative care, but somehow related to,
Yeah. So yeah, absolutely, and I think there may be other stratifications that may be there as well. And one of the things that we found was that the concept of empowerment runs across everybody. So even those who are end of life, and we do coach people at end of life, it's the ability to live my life well with what I have left, and and to live it with an active participation. So we found really that the concept of empowerment spreads across. It's human, you know. It's an element that spreads across all these stratifications. And we've got a couple of slides maybe to explore that. So maybe if we just share the screen again, Nicola. I think I've got it somewhere. So I was going to suggest there's perhaps two broad categorizations, maybe a little bit different to the ones you suggested, Alina, but I think there's that space of prehabilitation, so before treatment, where there's a real opportunity for coaches or mentors to support our clients build functional capacity. So that might be in activity, it might be in mindset, you know, getting your head straight to go through the next round of treatment or whatever that might be. It could be activity, weight loss, you know, all these things that fit within the integrative space around enabling that person to build as much functional capacity as possible, because it will be impacted by treatment in some way. And then, you know, if you can build functional capacity beforehand, then hopefully they will have a faster return to where they are. So that may be some more goal orientated, because there may be some very specific things that that individual would want to address. It could be weight loss, it could be activity, or whatever it might be. So there may be some very specific things which are perhaps more of the type of coaching conversation that we would have about meeting goals. I think that the other category I would have is just living with and beyond, which is this space around, supporting that person, taking active participation in all the elements of their life. The physical, emotional, cognitive, spiritual, social, work elements. It's, providing an opportunity to reframe or develop new attitudes, consider motivations and develop new ones. Finances, even changing the environment in which they live. And there's so many more of these things, but I just also want to just come back to, and this also operates at end of life. And it's an important perspective that you need to be aware of as a coach as well, because particularly if you're working within the NHS or some other type of organisation, actually you may not know if your client passes away, if there's a space between sessions. So how do we prepare ourselves as practitioners to support somebody in end of life is a really interesting question as well. And I just want to sort of just touch on the space of empowerment. And just have a read of these definitions and see which one really resonates for yourself. And there may be other definitions of empowerment, but for me personally, I think all these really speak to what, for me in some way or another. The middle one, it's a multi-dimensional process that helps people gain control over their lives and increases their capacity to act on issues they define themselves as important. That seems to have a lot of resonance for me with the definition of integrative oncology. So it's people using everything in their life to be able to empower themselves and have an active participation, which comes out very strongly in the top definition by Ferrer. And it's very interesting because he was an educationalist and said there's educational programs have a polarity. So you maybe have an educational program so that people will comply, to what needs to be done and maybe meet goals or such. But then there's an educational program that may support people gain this practice of freedom, and for me, this really sort of speaks to that active participation. And if you sort of break that down in terms of that definition, in terms of if we think about the cycle that creates, so really essential to that is, dealing critically with reality. There's an awareness piece there. So supporting clients develop awareness of what's going on for them and within their system. And, creating alignment and motivations for themselves and where they find themselves. No one of us really lives our lives isolated from everybody else. So it's about how do we align motivations. It could be with the medical team, it could be with the family, it could be with all these different other parts of the system to create that sort of informed choice or a planned action and then there's an application of that choice which creates awareness again, and then we go round again. And it's kind of interesting because I think our role as coaches is to support the individual find their way through this cycle in a way that it creates the empowerment for them to live actively in their lives. And again, just coming back to those 3 pillars, which for me and some of the team, we sort of envisage this as being the 3 pillars of this stool of empowerment. So, the awareness and finding access to information, but creating that learning environment is just so important. So these are just some of the things that we had in the book. Under awareness, the skills of presence and mindfulness for the coach and the client. EFT or other approaches that help you, bring you to earth or ground you with your energy, so be really truly present in the moment, can be really powerful. Awareness of how to use our bodies, just that whole awareness, that somatic sense of empowerment, and the way we stand, the way we walk, all integrates into how do I live actively in this moment. Diet, very important in all this area, and actually do conversations around nature and spirituality and what may be bigger than myself become really maybe kind of important areas for the client to explore and grow. There may be a whole host of areas that you might want to share in terms of various measures of health or breath work. And in the book, we have a chapter from Gavin Andrews from HeartMath UK. And there's lots of technologies around it support people to sort of be coherent in the moment from the physiology, which sort of links back to how do we use our bodies to empower. Breathing's so powerful. The doctor's role, shared decision making, and a model I'll touch on in a moment around personal leadership can be all really useful models for the coach and the client maybe to explore, because this is a co-created learning environment. I don't know about yourselves, but I always feel I learn so much from every client I've ever worked with, whether it be about me or just learning more about my trade and my craft. But it's really important that we sort of tune into having some support for ourselves as coaches through supervision. And learning the skills of metaphor, clean language, conditional language. These can be really, really important in terms of creating that place of empowerment. And and also that great question around what's next. So this is just something for us to maybe think about as coaches in terms of this construct of personal leadership. And this just brings together some important areas around living mindfully. So building mindfulness and presence as a practice into your practice as a coach, but also how to support our clients do the same. And this touches on that point around this is a long-term learning intervention. These things happen with practice. A concept of resilience that we found very, very useful in this area is that one developed by Aaron Antonovsky called Salutogenesis, which is an orientation around health promotion. So it's building the attitudes and beliefs that allow me to cope and adapt to my situation. Very, very important in terms of being able to be empowered and thrive, whatever I find myself. Self-leadership, again, lots of work done on this over the last 20, 30 years, particularly in terms of skills that create self-development in people. Again, a model that came out of the business world, but it's really tuning in to those natural rewards and that space of reflection around what's going to be useful for me right now. And again, we work together in communities and with others, and so building leadership skills, particularly around maybe collaboration, aligning resources, very, very important concepts in which we can sort of support people and provide a framework maybe for our workers as practitioners.
Andrew, Teresa makes a really good point in the chat. She talks about empowerment and active participation, and she says those two really resonate with her. Teresa, I know you're in Singapore at the moment, and I think battling probably connection and dinner time as well, but she makes the point, she says it may help to move the client away from a victim mindset, so to have some measure of control.
Absolutely.
That sense of empowerment and active participation.
It's about agency, isn't it? It's about that space of having control, or influence is a word I often like to use. Because, you know, if we think about control, there's probably very few things we control in our lives, absolutely, but we may have an opportunity to influence them. But that active participation is, you know, creates that sense of agency, and I'm shaping the world around me, which I think so important for all of us in our lives, but, you know, perhaps particularly when we're working with this client group. Yeah, thanks, Nicola. I've lost my chat function after the breakout session, so thank you.
Move along as well. I mean, just I've got the chat as well. So Nagesh says that letting go of what is unrealistic a form of empowerment, or letting go at the end of life. Nagesh, did you want to come in and expand on that one a little bit?
Yeah, part of it is, you know, I was thinking of, you know, I'm from India and my mother had cancer for about 4 or 5 years. And from the US, we went back to India, and actually I did some research on this finally, because physicians to some extent, you know, shared news about what my mom was going through, either in very small doses to us and not to my mother. And really kind of based on therapeutic privilege and where my mom was in terms of what was going on. And in some ways, watching her go through it, you know, I saw actually value in her not having to control everything or feel like she has to make decisions, and being at peace. And towards the end, you know, if you will, hanging on, and I know how far this is true, you know, medically or through evidence, our palliative care person said in some ways, whisper in her ear that she's okay to let go, because she felt like she was really hanging on when there was really nothing more we could do medically.
Yeah, thank you, Nash. Very, very, very powerful. Thank you so much. And I think choice doesn't, or active participation doesn't need to be active. It can be that space of surrendering or giving up, or of acceptance as well, or, you know, whatever it may be. And I think that's the beauty of our role as coaches in this area, because we're helping individuals really get clarity of what that is for them. And it's so important for us to be really tuned in to not our view of the world, but trying to support, you know, the client sharpen their own. And I think, you know, one of the most important things I always try and remember myself as a practitioner, it's not my story. You know, I'm here for that person to help them build or shape or get clear on that story. And thank you for that. And that leads very nicely on to the next couple of things I was going to say, because this really is the power of conversation, isn't it? You know, we sell so much out if we can create that safe space and have that power of conversation. You know, we hear all this and what's going on for people, and I think our ability to reflect that back and create that mirror, as we say, is what we do as coaches or mentors, so that people can have a really clear look at what's going on for them, and then make some choices around how to change it or not. But you know, but to do that with a consciousness, I think is really, really an important part of our role. And I think this comes into that sort of transformation and learning. We try to summarize, you know, all the fantastic research that's been done around adult learning, and boy, is that a hard task to do. But I think a couple of really interesting sort of things just to think about as coaches in terms of how do we create that environment. You know, there's an element between learning motivation, which can be very high for people who have a large change or a disruption in their life. You know, often, you know, this diagnosis results in people wanting to make huge changes in their life. And the learning outcome then may be, you know, it's often, well, actually, this is the time for transformation. You know, this is the time to reboot or reconfigure. And, you know, often psychologists talk about post-traumatic growth. It's that ability to move beyond what was happening to me to configure or sort of adapt to actually create this sort of transcend into a transformative learning. And often, you know, I think this often means a sort of supporting the person get really clear about meaning, you know, their identity, the schemas that they run, the categorizations that they have in their life, how they operate, how they make sense of the world, and particularly an opportunity to sort of retune into values and beliefs and building, you know, skills, competencies and behaviors. And what a great opportunity for us to be there as coaches. And just coming on to the place of, you know, where does coaching support mental health? Because that's mental well-being, that's really what we're talking about here. And this is a model developed by Professor Sarah Corrie, which we found very, very, very helpful in terms of our practice in the centre, and for me personally as an independent practitioner. Because we often talk about, you know, coaching is in that space of where people have got high function, high resources, making them, you know, going from good to even better. You know, if people are functioning, but they're sort of on the limit and they've not, you know, got too many resources left, well, you know, they may be managing their circumstance, but actually if additional demands are placed on them, it might be, you know, difficult. You know, that might be a place to think about, well, is this coaching the best possible support for an individual? And of course that will be very, very much dependent on the practitioner. You know, as if somebody is sort of, well, you know, maybe not functioning as best as I possibly can, but I'm getting through things because I've got so many resources around me. You know, that might be a place where we might want to consider. But perhaps where we don't want to go as coaches is actually if people are not really functioning and they're really struggling. You know, that's not a great place where people can sort of support and learn from. And so, you know, as coaches, it's really important we can think about these perspectives for our own self-care, about what I need to do as a coach and how do I support myself working with people going through not great stuff, and how this can be used in supervision, but also importantly, how to signpost on to other services.
Just to complement what Andrew was saying, Andrew, doesn't your mindset also play a big role in this?
Yeah. Totally, I totally agree, Winston. And I think, you know, the mindset of the practitioner there is absolutely key, because we're not there to solve anything. We're there to support that individual solve it for themselves. And you know, and I think that's just such an important development for us all as practitioners. And I often say with all my clients, you know, the beauty of my role today is I don't have the answer. And I think often that's a difficult place for healthcare professionals to occupy, because it's hard for experts not to know. But you know, leveraging that skill of not knowing is actually the really powerful skill that creates that place of learning. At least in these coaching interactions. Yeah, and I think this is also, Ros, totally transferable. This is, you know, we're really a group of executive coaches who support our time, but this is how we operate with many of our people going through changes and transitions. Empowerment's, you know, it's human, isn't it? It's everywhere. Yeah, thank you, everyone. Yeah, and I think a great point from Marana there, that I think we, you know, to be able to occupy and operate in this area, it's something that we need our own self-reflection and our own self-development on all the time. So, you know, it kind of is in many ways what we used to call like an inside-out leadership development. We have to work on ourselves to be able to work with others sometimes as well. So, you know, I think that's such an important point.
So Andrew, sorry, Heather, go on. Yeah.
So coming back to that question at the start, earlier on in the session, where's the line between a need for counselling and mental health support and coaching? Yeah, I think I think that's always going to be a difficult line to tread. Andrew, you described the arrangement where there was a medical team overseeing, or at least a specialist overseeing the overall provision for the clients that you're working with. And as a coach, that would give me a lot of reassurance to know that you're effectively contracting within that within that arrangement. So you effectively have a sponsor, if we're talking in our normal coaching language. You know, you've got somebody who's kind of validated and said, yeah, this person would, you know, coaching would be helpful for them. It would be interesting thinking about how I might work with somebody in that situation without having that mental health expertise oversight. So yeah, I don't know what the answer would be for that. It would be an interesting one to explore.
Great point, Heather. And I think these are the things that we need to work our way through as practitioners as well. And I think perhaps, you know, from an organizational perspective, you know, for ourselves, it's what's my policy, what's my safeguarding policy, what's my principles, and how do I know, you know, when I'm not the right person to support someone, and how and where to signpost to provide some other opportunities and other services. So I think that's a really important feature of how we sort of support our practice. And we don't often think about those things as coaches, but actually it's probably germane to most of the work we do. You know, how do we know when not to work with somebody? You know, is a great question to have, and I think it's something for us all to reflect on. Absolutely. And don't forget supervision.
Indeed.
Can I say on behalf of the EMCC Global, thank you so much, Andrew, for leading this conversation. I think that the exploration of how coaching is and how supporting people is has just been so amazing and just so aligned. And I think that we've all just grabbed new nuggets of newness out of this conversation. So thank you so much.
Thank you so much. No, really appreciate everybody's input and conversation, and wonderful to be, you know, learning together, and that's what it's all about, isn't it? So thank you so much, everyone.